CPN is honored to offer this session of information to you guys tonight for information purposes, but we do not endorse or sponsor any of the products or services that are presented here tonight. We're just happy to bring them to you. So with that, I'd love to get started, and I'll do a little bit of an introduction. We often say at Courageous Parents Network that we're by parents for parents. And this is really sort of a tenet that we live by. Our curated library represents, I think, more than 70 parents and clinicians' voices, bringing the hard-won wisdom of other parents and providers to all of you so that you can learn and create a better situation for your own caregiving experience. The vision of CPN originated with Blythe Lord, who's here with us tonight, our founder, who brought her own experience loving and caring for her daughter, Cameron, combined it with her expertise in distance learning to bring us Courageous Parents Network, because she saw a need in a community for great resources to support the psychosocial and emotional needs of parents. And so she used her own experience and the ideas that she had from her business background to create Courageous Parents Network, which we're happy to say is now 10 years old. We're really thrilled for that. And tonight's guests are not dissimilar. They both took their hard-won wisdom and their lived experience and turned it into a resource for other parents. And so I just wanted to take a minute just to sort of pause and celebrate the strength and resourcefulness that parents bring to the table, and our mutual commitment to help one another as we're doing really, really, really hard work. So I'm honored to introduce to you tonight Ryan Sheedy, who's dad to 3 boys, twins Campbell and Reynolds, and baby brother Mac. Like so many parents, their life was drastically changed when Reynolds was diagnosed with Costello syndrome shortly after his birth in 2018. Ryan became a stay-at-home dad. He spent countless hours immersed in hospital visits, doctor's appointments, coordinating school stuff. It's what I like to call combat coordination, because you're doing it like, you know, it's flying at you and you're just doing the best you can to catch all the pieces and put them together. And it was out of that experience that mejo was born. And I'm sure that you're going to realize that this tool is going to help make that combat zone of coordination a little less onerous on all of you. When Sierra's son, Jack, who also happens to be a twin, so I'm going to just put that twin win for tonight into the comments, was born, his twin sister's name is Charlotte, was diagnosed in 2021 with Warsaw breakage syndrome. There's a mouthful. She hit the ground running looking for resources to help her family. And what she found was it was a very fragmented system. And so she took the opportunity to put together all the pieces and bring the resources into one space. And that's how Librarey was created. Really, she saw a need and went out and also sort of harnessed her own energy and her own willingness to help her own family, to help others. So I'm really happy to bring these 2 individuals to you tonight. And again, just to sort of say power to the parent. And we'll start with Ryan. And Ryan, I'll just let you get started.
Awesome. Hi, everybody. Thanks so much for allowing me to tell a little bit about our journey and the product mejo that we've launched out there for the medically complex rare disease community. And please feel free to ask questions. I'd love to keep this as interactive as possible. So let me share my screen here. Can everybody see my screen? Perfect. So as Jennifer mentioned, I'm Ryan Sheedy. I live in Bentonville, Arkansas with my wife, Ashley, and our 3 boys, Campbell and Reynolds, twin boys who are 6.5, and our little guy, Mac. Life wasn't crazy enough. We said, let's have one more. And so really have a great family, and we're in all of this together. As Jennifer mentioned, one of our twin boys, Reynolds, has an ultra rare disease called Costello syndrome. Prior to 6.5 years ago, I didn't even know what a rare disease was. I didn't spend much time in hospitals. When I got sick, took Advil. And just like most parents of medically complex and rare disease kids, we dive right in. And so here's Reynolds at the age of 3 standing beside his electronic medical record printout that we had to get while we were submitting for some assistance. And his case manager asked me if I wanted his medical records. And I said, sure, put them in the mail. And she said, I can't. It's 7,000 pages. So I did what any other parent would do. I met her in an IHOP parking lot, and she handed me ream after ream after ream. And when I got home, I looked at it and said, there's got to be a better way to explain Reynolds and his medical complexities. Taking care of him daily is a challenge. I had to pause my career to become his full-time caregiver because we were spending so much time in and out of the hospital, having so many different procedures. He left the NICU after 103 days with a G tube. And so he was very complex. And as you can see, he's very complex on paper. But what those medical records don't tell you about Reynolds is that he has a twin, like I mentioned. He just started kindergarten. He loves the color blue. Well, it used to be purple, and now I have to get used to saying his favorite color is blue. He loves the show Blippi. He loves to give high fives. He does equine therapy. He has a G-tube, as I mentioned. He communicates with an AAC device, but is now learning to use some words, and they call him the mayor. And as much as I spend time talking about his medical condition, I also want people that are caring for him to know who he is beyond his chart. As most of you who have care for or have children with medical complexities, this snapshot of my countertop is probably not an unusual picture. This is kind of a snapshot of what daily life looks like caring for Reynolds. There's so much information. There's Post-it notes, there's charts, there's the binder that everybody has. And I needed a way to streamline all this information because, I had to tell his story over and over again. So just like any parent would do, I created a little one-pager in PowerPoint that told a little bit about his story. And I would pass this document out to different nurses and doctors and providers and Medicaid and therapists for my own sake and my own sanity, because there was just so much information to keep track of. And as rare disease and medically complex parents know, at a moment's notice, and I joke, I might get a phone call during this call, somebody's asking me for a date, information about his medications. It's coming at us from all different directions. And as a parent and caregiver, you have to be on top of your game all the time. And it's stressful and it's emotional. And, I quite frankly got frustrated that there wasn't a tool for people like me to organize all this information, share it, and really bring up whoever was caring for Reynolds up to speed very quickly. And so when I talk to a lot of parents about this idea, and still today, one of the things that I often laugh is when somebody said, I put it on a Post-it note and now I can't find that Post-it note. And I'm sure that's very relatable to many of you in this call. There's just so much information and it's all different places. And I really wanted to create a tool that really was from the caregiver's perspective that clinicians and therapists and school got to benefit from. And it really helped me take what I had up here and share that information very quickly and take a lot of the emotion out of it. So in 2022, we launched mejo, which stands for Me Journey. My friends in California and Texas call it mejo, which actually works because that means better or son. And Reynolds, our son, was the inspiration behind it. And mejo really helps you manage care information with ease when it matters. Our platform streamlines medication management, care coordination, information sharing, all while providing access to curated knowledge to make caregiving more efficient and effective. So there are a ton of different features and functionality within our application. It's 100% free. It's available in the US, and it's a web app, so there's nothing to download, and it's accessible on any connected device. So let me run you through a quick demo. And so our platform is very simple. We feel like it's got a really great interface. You'll see teal is my favorite color. It's my uniform. I wear it every day. And we wanted to create something that, families felt really good about. In our first section, we allow parents and caregivers to tell a little narrative about their loved one that's typically not in a chart. So this really comes into play when you're sending this information to a new doctor, you're leaving it behind for a new babysitter, you're going to a school, and this allows you to tell that story, like I showed before about Reynolds loving the color blue, loving to give high fives. He's got a baby brother. These are types of information that when a provider gets this document ahead of time, they're able to create that connection that they wouldn't have been able to have if they only read his chart. And so when a provider comes in and gives Reynolds a high five, I know they read the document, but also Reynolds feels a little bit more comfortable around that individual. You have the ability to select from our icon library to really graphically show the key points of your loved one. We have sections in here like medications and conditions, and we allow the families to really put information not just about what medications they're on, but how that individual takes the medication. So those care instructions we feel like are as important as the actual medication. Because if you only looked at the chart, they would only tell you that Reynolds takes a growth hormone weekly. But what it doesn't say is he gets it on Sunday nights, that it's located in the fridge. And we have also given users the ability to hyperlink to how-to videos and documents related to those different medications and conditions. You can call and email directly from the app. We have sections in here for emergency contacts, information for primary care. We also, because we're caregivers ourselves, we put in sections that aren't typically captured in other applications, like spaces for equipment and devices. Again, for our son Reynolds, he takes a bunch of different breathing treatments. He has a G tube and so forth. We have sections in here called My Team. So as parents and caregivers of medically complex and rare disease kids, we know their teams can be very large, and there's a lot of contact information that's floating around in our phone that at a moment's notice we might not be able to find, or your spouse who is not the primary caregiver needs to call, and we're not sharing tons of different contacts. They have a place now that they can go, and it has all of the contacts right there. So not only doctors and providers, but Medicaid and emergency hospitals and DME companies. We have sections like My School and useful health information. So this information is all self-input, and it really allows the caregiver the ability to take what they know in their head and they want to share with anybody who's caring for those individuals. And at a moment's notice, you're in a doctor's office and someone asks you to recite a date. And we all know it's hard to sometimes recite information when you're trying to keep your loved one calm in a waiting room. Now Mejo allows you to, in a few quick swipes, get to that information. You then also have the ability to download this information into a usable PDF. And we heard from early users that sometimes they just wanted to send the medication list, or sometimes they just wanted to send the immunization information. Mejo now allows you to select those sections to build custom PDFs based off of that situation. So for back to school time, which is happening right now across the country, you now have the ability to send a very quick medication list to the school nurse and not having to rewrite it every single time. We have the ability for families to upload documents like seizure action plans and insurance cards and IEPs. I have in here information on how to use an EpiPen. So when I shared that Mejo with grandma, in the event that Reynolds has peanuts and he has an allergic reaction, she's now not going to Google trying to figure out how to give that medication. We now have a tracker Our tracker is 10 times better than using your notes on your phone. It's not a standalone, diet or seizure app, but it really is functional. We used standardized measurements. So like for bowel movements, a lot of families are tracking bowel movements. We use the standardized tracking category information. You can go in here and track mood and behavior. We have a standard library of tracking categories, but we also allow families to create their own tracking categories. So for our use case, I can never remember as a parent when I changed my son's G-tube the last time. And my wife and I often say, hey, I think it's time we got to change his G-tube. When did we change it last? And we now have the ability to go into mejo and look all that up. You can then also download all of these entries into a usable PDF. So if a provider is asking you to track seizures or medication, you now can download those entries into a usable PDF and email those entries to a provider. The last feature and capability that we have is our sharing. And so we know at a moment's notice, we get to share this information with a babysitter. Families are utilizing this tool when they're in the ER and you're being asked a ton of different information. You're now able to send this information via text or email. You can select which sections you are going to share with that individual. And then you have the ability to put a timer on it. So if you only want to share that information with the ER doctor for 12 hours or the babysitter down the street, you can select 12 hours. Or you can share that information with grandma and select always. And the great thing about our platform is the intuitiveness of it. If you edit or add information, you don't need to resend the link to grandma. It reflects in real time. The other great thing about this is everything is being saved as you go, so you don't have to hit the save button, or if you lose your session, there's a fear of that information not being inputted. Everything is being saved on the go. You also have the ability to attach documents and attract those tracking categories. I pre-did a link that Jennifer will send out. This link will be live for a week for you to test it out. The secondary measure of security is the child's date of birth. So of course, if you send it to grandma, she knows what Reynolds' date of birth is. And so that just allows us to have a little bit more security with that information that you're sharing. So that's a little demo of mejo. Any questions, comments? Or we can wait till the end. Okay, great.
I actually did put in a question in the chat.
Yeah, Ryan, the question is, can you upload videos to mejo to illustrate, show people your child in action in home and things like that?
Not to date, but that's something that we're working on that we'll be releasing pretty soon.
And can you just tell why the name? It's so unique, and I'm curious. I'm sure there's a story behind it.
Yeah, so it's kind of funny. My wife and I, who both were in marketing, wanted to come up with a name that wasn't so literal, but could stand the test of time. And we whiteboarded it for many months. And naming a company is harder than naming a child because it's got to be trademarkable. It's got to have a URL. And one day, Ashley blurted out mejo, and I said, "Oh my gosh, okay, tell me more." And she said, "Well, it's the journey of me, or it's a medical journey, or a medical journal." And so we got really excited about that. It was available, and then a few months later, somebody brought up mejo, and it just kind of coincidentally worked. So we're really excited about the name and what it stands for. So the great thing about being a parent-led company is that we get to connect with other parents who are using the platform, finding the platform, and for us, that means everything. It's not just about the features and functionality, but it's about what it's allowing these parents and caregivers to do. It's helping them in their everyday life. And so I'd love to share a couple stories. Our first family is Laura and Sam. Laura found us through Instagram. Her son has an ultra rare genetic disease. He's very complicated, but she felt a sense of relief and peace of mind having all of his information in one place. She got to send him to camp for the first time without a caregiver or a nurse. And she sent me a picture of his camp bag with his printout sticking out and said, "Thank you for making this. I now feel, a sense of peace of mind that in case something happened, they had all of his information." And then the next day, she forgot the bag at home, but she was able to securely share that mejo with the camp counselor. And I thought, how amazing is that? He got to go and be a kid. But it wasn't until months later I realized that she also got some time off that we as caregivers desperately need. And so that right there is the whole reason why we do what we do. She loves sending mejo ahead of time for Medicaid. So now she's saving 30 minutes a quarter because they don't have to go over the same information over and over again. She shares mejo with Centers of Excellence prior to going to a clinic, which now the Centers of Excellence are asking her by name, "Can you send mejo ahead of time?" How awesome is that? Mm-hmm. This is Blythe, Chris, and Maggie. Maggie has a rare disease as well, and they were on a trip. And we as parents know being on a trip sometimes is scary because what happens if something happens and we're in an ER that doesn't know my child and they don't have access to the medical records? Well, thankfully, Blythe had mejo. And she said, "It's scary to be at a facility that knows nothing about your child's diagnosis and doesn't have her records." But thankfully, she had mejo and she was able to move forward. I'm sure many of you guys know Effie and Ford from Once Upon a Gene. Effie has been a huge champion. She talks about how this app is a game changer in a lot of ways. It helps keep you organized and you have the ability to update it, and it's not really a chore. And so it's really great to hear folks who have the voice like Effie support mejo and communicate it out to her community. And this is Kristen and Ellie. Ellie was undiagnosed for many, many years, and Kristen felt like she was sometimes a broken record, repeating the same information over and over again to different doctors. Thankfully, she was able to get diagnosed, and Ellie takes 18 daily meds. That is a ton. Imagine this. For those that fill out Medicaid forms and they only give you 2 lines to fill out your medication list, now you have mejo to attach. She's able to be seen and heard because now she's empowered with this information. Since launch, we have been celebrated, talked about, connected over social media beyond what I ever truly envisioned. And it's been great to have folks really share mejo, talk about how they're using it, share it with their communities, and really help spread the word. So our top 5 ways to use mejo are, if you're tired of trying to remember it all, we've got you covered. If you have form fatigue, say see attached. Searching for documents like seizure action plans and insurance cards, it's already in there. Constantly responding to requests, share mejo in seconds. Starting a new med or treatment, now you have the ability to track it versus using the paper and pen that is often given to you when starting a new medication. We have a few ways to connect with us. Obviously, we love talking with caregivers. Mejo will always be free with our journal and sharing capabilities. We'll be launching a premium version that has the documents and tracking. So, sign up takes 60 seconds or less. We started talking to advocacy groups who have wanted to build their own app for many years, but didn't have all the money that it takes to build an app or someone on their staff to lead a technical project. So we're working with advocacy groups. We're now talking to industry and pharma on how to utilize our tool during drug launches or supporting advocacy groups. And then working with healthcare and hospitals on different research projects, utilizing mejo and our technology to gain better insights and give families something that's useful for them in their everyday lives. As I mentioned, working with advocacy groups, we got connected with the International Rett Syndrome Foundation. They said, we've been wanting to create an app and we should work together. And so last year we launched My Rett Ally, that is sponsored by the International Rett Syndrome Foundation. And it's been amazing to work with the Rett community. And we tailored some of our features and functionality to that specific condition. And we're able to preload some of their documents that they have. We built specific tracking categories for Rett, and we're working on a chat bot that can go search for information from their curated resources and documents. This is Yesenia and Alessandra. Alessandra has Rett syndrome, and Alessandra started one of their new treatments. Yesenia is a technology person. She used My Rett Ally to track these symptoms, which then she was able to send over to the provider, and the provider was then able to better optimize the dosage based off of the tracking events that Yesenia sent her. So really meaningful use of the technology has been used for and with the Rett community. And I will close with this. One of my favorite movies, even before having a rare disease kid, was Patch Adams. And this quote that states, "You treat a disease, you win, you lose. You treat a person, I guarantee you, you'll win no matter what the outcome." And I think for all of us on the call who take our loved ones to see providers, to see therapists, to see folks who are caring for them, we want them to know our kid and treat them not just as a disease that they have. And that's the mission that we're on, is to help caregivers tell that story, help caregivers save time so that they can be parents and they can be loved ones, not just caregivers. So thank you very much for everybody listening in on our demo and our story. I can be reached and contacted. I'm sure we'll be sharing that information out there, but I look forward to talking with you all, and hope that you guys will sign up for mejo and check it out, and hope it helps you in your everyday life.
Thanks, Ryan. We really appreciate your time, and especially the stories about how all the other parents are utilizing mejo. I think it really brings it to life. Sierra, I would love to welcome you to start sharing your screen and tell us a little bit more about Librarey.
Hi, thank you. Let's see, let me share. All right, so thank you, Blythe and Jen and everyone at CPN for inviting Librarey to be a part of tonight's In the Room. Starting by sharing a little bit about the background origin story of Librarey. So this is my family. This is my husband, Justin. This is me. These are our 3-year-old twins, Charlotte and Jack. They were born on St. Patrick's Day of 2021. We knew when I was pregnant with them that Jack had a congenital heart defect, microcephaly, and severe growth restriction. So I feel like that part is pretty unique. I wasn't blindsided at birth with what I thought was a normal, seemingly normal pregnancy, and then had a baby end up in the NICU. I knew when I was 14 weeks pregnant that one of our twins was seriously struggling and was going to be in for a very long journey. I did my PhD in human and molecular genetics and my master's in genetic counseling, and worked doing alliance management for a CRO, and I supported all of our rare disease biotechs. So I always say I knew enough to be annoying. So I knew enough to know that it was something genetic, but did not know exactly what. And I got Jack diagnosed when he was 7 months old, which was the earliest a child with Warsaw breakage syndrome has ever been diagnosed. He was around the 20th diagnosed patient in the world, and the second one to get cochlear implants, because he was diagnosed early enough for him to be implanted in time for it to make a difference. I'm a full-time working mom. My husband is self-employed. He's a blacksmith, And so we didn't have the option for him to stay home and me to work, or me to stay home and him to work. So we hired a nurse. We actually took her straight from the NICU, took her home with us. We were paying out of pocket because I didn't know about Medicaid waivers or any of that. So I could keep my job and have someone to care for Jack, and so we could keep our whole ship moving. Jack came home at 6 weeks old, 1 week after Charlotte. He actually did better in the NICU than Charlotte. He had better APGAR scores. He probably could have been discharged earlier. He just needed to be big enough to leave the incubator. He was born at 810 grams, and he had to be 1,500 grams to leave the incubator. He was doing really well until about 3 months old, and basically overnight, he stopped taking his bottle. That ended us in the hospital for almost a month. We went through like every test under the sun. I'm screaming genetics, Halexum. They're saying, no, everything's fine. Finally got them to order the Halexum because I wrote the prior auth and filled out the TRF myself and tricked a resident into signing it. I knew enough to be annoying. And it wasn't until we were pretty close to filing for bankruptcy. Jack had just had his second emergency helicopter ride. And we had just gotten the bill. That was like a $75,000 bill. We were drowning in medical debt from the NICU, from paying out of pocket for a private duty nurse for our son. And we were at a party with some friends, and I'm close to tears. And this woman comes up to me, and she's a friend of a friend. And she's like asking if I was okay. I'm word vomiting, no, telling her everything. She looks at me and she goes, "Does Jack have a waiver?" I said, "What's that?" And she tells me, and I was like, "No, how did I not know about this?" So that was really the catalyst moments. And there have been multiple stories like that. That was the most severe, most impactful for our family, especially for our financial situation, where you don't learn about things until either it's kind of too late, or like you wish you would have known sooner. Like we have in Richmond, Virginia, where we live, a local DMI intensive called Hope Therapy. And I didn't find out about it until Jack was a year old, and there was a year-long wait list. But it's one of those things that none of his doctors or therapists or caseworkers, no one told me about it. Another parent told me about it. So I started making a list on my computer, like a little Word doc of all the secret sauce that I was learning from all these other families, that I thought initially was just a product of my kids being born during COVID. And we, we're kind of isolated. The NICU's already isolating, but it was extra isolating. You didn't get to see anyone in person. But as Jack got older and the kids got older, we started being able to go out and meet people. And I was talking about our story. I learned that this gap in communication and lack of info sharing was not a COVID problem. It's been happening forever, and it still happens today. I see every day, I try to check the Facebook groups I'm in, and there's always someone who's asking, how do I become a paid caregiver for my child? Or like, what's a waiver? What's respite? And these people have kids who are 7, 8, 9, 10, 15, like years and years and years old. And Jack was 11 months old by the time we got him a waiver. And I knew how much those 11 months devastated us and our family financially. So it really accelerated my passion for, all right, there's clearly a lack of info sharing. Hard to tell like what the source of the problem is, but people, especially these families with these really complex kids, aren't being told about all of the resources, services, organizations, therapies, equipment, grants, you name it, all the things that are out there for them. And they usually don't find out about it until it's either too late, or it may not be as useful. And that's usually they're finding out from another parent. So I started, I pulled these numbers back in January when I gave a presentation, so they're a little outdated, but this goes kind of along with what Ryan was saying. Thousands of hours of therapy, probably over 500 medical appointments, so many surgeries, done probably close to 300 insurance appeals to date, multiple Medicaid waiver applications, and so much advocating. It's exhausting. It's so hard. And I am privileged enough to have full-time care for my son and to be educated, and filling out the Medicaid waiver was probably one of the hardest things I've ever done. And that, brought me to tears, being like, this was so hard for me. This isn't fair that people who don't have the time and the resources to sit down and get help aren't doing this. Maybe not because they don't know about it, because it's hard and they don't know how to fill out the form. They don't have the help. And then you have to appeal it and spend hours on the phone, and it's a lot of work. So for the first 2 years of Jack's life, instead of watching his pulse ox monitor every night, I would be on my laptop and I'd be Googling things, grants, camps, organizations, anything and everything that I thought could be useful, and, writing, adding it to my little Word doc, which some of you may have seen. Let's see. It was originally called the Disability Resource Guide, and the subtitle got very, very, very long. So I was trying to be inclusive of everybody, and ended up being almost towards the end of over like 500 pages. And the PDF was super clunky. It was crashing computers. The hyperlink stopped working. It was really hard to navigate because parents usually were looking at it on their phones. So you're having to zoom and scroll and try to click, and it wasn't serving the purpose I had intended it to be. And one of these nights when I was up super late, looking for other resources that were out there that I didn't know about, I ran into this website called Commend. And it looked like a super new website. It said that they were a group out there looking to help rare disease patients and patient advocacy organizations. And this is a screenshot from what the website looks like today. So it's a little bit different, but there was a button instead of the get in touch right here. It said, join our wait list. So I joined it, added it to my little Word doc, and they emailed me and asked if I'd be interested in doing some sessions with them, working on some sprints for some of their pilot ideas. And we did a couple of those. And Albert, who was here, and Fonson, who was here. Albert's on the call today. Fonson couldn't join us. After we'd done a couple of sessions, they basically were like, you've been so helpful and have shared so much. Is there anything we can do for you in return? And I said, actually, yes. Could you please help me take this PDF and turn it into a useful website that's easy to navigate, that people can use from their phones, use from their computers, use from everywhere. I wanted it to be family led and community driven. So I wanted people to be able to add resources that they know about that might not be a website that maybe, the church they go to does buddy respite hours the second Sunday of every month, the things that you are hard to find on Google. So that's kind of how Librarey came to be. I bumped into them by happenstance, and we've been working on it ever since. And now I'm going to pop over and do a quick little demo. And if anyone has any topics or questions they want to see while I pull up my other screen, shout them out. Okay, so this is the landing page, and we'll do the little quick take the tour. So when you come to the landing page, you will see the search bar. You can start by typing in some keywords. I find, and we've heard from other people, sometimes it's hard to know what to search for when you don't know what's out there. So the next option is, if you don't really know what you're looking for, is to hit browse them all, which takes you to this page, which has all of the almost 5,000 resources listed like this, where you can then start to use these different categories and filters to narrow down and to kind of give you an idea of what we have in here and get your wheels turning to see what you may not even know about. You can save resources to a collection. In order to do this, you'll have to have an account. It's free. It's a library like mejo will always be free. We ask for very little information when you sign up for an account. So you can create custom collections, and you can view your saved collections in your account. You can share them. We now have it so you can embed these collections on a third-party website. let's see. Whew. So I like to start with, we can do clinical trials. So this will pull up all the resources we have, all 104 on clinical trials. If you want to add in some additional filters, it narrows them down. There's 5 that talk about clinical trials, drug development, and genetics. You can filter by location. I live in Virginia, so you can see everything we have in Virginia, and maybe you want to look for bereavement resources in Virginia. So I have 6 in here. So it pulls it down like this. You can save it to a collection. You can share it. And that's really it for right now. We're working on some additional features. And this is right here is if you want to add your own resource, you click that button, you put in the name, the link, description, you add what type of resource it is, the location, and the categories. We are also working on a calendar. So we've heard from a lot of people that having a central place that has kind of national level conferences, family conferences, also grants and financial application deadlines and cycles. We're trying to collate all that into one place so you can figure out what's going on, when are the deadlines for this, when's the next CZI grant cycle opening, when's the next conference, where is it? Building out some additional features there. If you want to read more about our story, it goes into better details here. We have a great FAQ section that will go step by step onto how to use all our current features. And that is really it. It's been a wild ride. We started working on the library in May of 2023, launched the first version of Librarey in October of 2023. So it's almost been a year. And we, have been working hard and can't wait to see where it goes. And Commend has been great. Librarey is the first product of Commend, and they're working on some others, Symantec and a third one that will be launching next year to really help families and patient advocacy organizations feel empowered and find resources and accelerate research.
Sierra, thank you for sharing this. How many times at Courageous Parents Network, families reach out to us and they're looking for resources, and this is a great tool for us to be able to find and search things. And I know I would have appreciated this, back in the 1990s when I was first starting out with Ben and trying to just cobble together where to find different resources. And equally, Ryan, then the burden of trying to organize the resources and organize the information, and the way that mejo has made it also visually appealing so that you feel welcome when you're coming to it, instead of, I can remember looking at those stacks going, oh, I've got to do this again. So anyway, I'd love to open it up to anyone else who has questions, and we'd invite you to turn on your camera if you have a question, and you can just raise your hand like this, or you can use the little raise hand thing on Zoom, and you can direct your question to either Ryan or Sierra.
Sierra, I'm wondering, when you say users, first of all, both of you, Ryan, Sierra, you have done, as Jennifer said, like the parents that you are, you've done extraordinary things, born of your own, understanding the needs deeply and widely. And I'm glad that CPN can be a channel to get the word out about these resources. Sierra, when you said that people can upload new resources, when they upload it, can everybody see it?
No. So
how do you control, like, I'm just wondering how you do
they get submitted
quality control.
Yes. So I skipped over that part. So when you submit a new resource, it gets sent to our admin dashboard, and the resource then gets vetted and verified by one of the admins on our team to make sure that it is a legit resource, that it is, if it's, a patient advocacy organization, they have good standing, they're active, the website's still working, they still are offering services, that it's not a scam. We do our best to vet everything to the best of our ability. And then we run checks every so often to make sure that all of the websites are still functional. And we have a feature where you can report a resource if the link's broken, or if the organization has sunset or closed for whatever reason, or is no longer operational. You can report that if you come across it or know of it before we are made aware of it.
That's smart. Thank you.
And Ryan, I had a question for you, which is, I know that you can you assign, for example, a teacher who can put in data into mejo as well in a separate, like, can they have their own separate section where they report out to you what might have happened during the day, or are you, as the owner, the only one allowed to share and enter?
Yeah, right now it's a single use account platform, but that does come up a lot from communities that have people that care for individuals. And so we're looking into that, but today it's just a single use platform.
Hi, I have a question for Ryan. I may have missed this in your presentation, so I apologize, but is there any reason why mejo can't be used with an adult as the patient? I mean, it seems to me like it's just a a good resource, and so it
Yeah.
has all the right fields, like,
Yeah, great question. So initially we built it for the pediatric space because that's what I needed. My co-founder also has 2 kids impacted by rare disease, so we launched it as a pediatric platform. But we hear all the time, "Hey, I'm using mejo and I'm in my 30s or 40s, or I'm using it for my parents." So we are currently working on a refresh so that it won't have such a pediatric feel when you enter, I'm over 18. But anybody can use it. We're just marketing it and talking to the pediatric space. But I hear all the time, "Hey, I'm using mejo for my parents," or "I'm using mejo for my dog," or I'm using mejo for my whole family. So hearing that feedback has been awesome. But right now, there's nothing stopping from anyone using it.
I loved one that I saw in your personal profile when you were sharing it, that you had a tab for each one of your children.
Yes.
And I do actually appreciate that very much, because it is the case that oftentimes the less medically complex children don't have the same resources built around them because we spend so much time, but it's one tool, multi-purpose. You could have it for your parents if you wanted to.
Yeah, and my parents have chronic conditions, so they have mejo, but for all 3 of my boys, one's got a peanut allergy, one's got other conditions. And so I as I mentioned before, having kids in school, you're always being asked for some sort of information. So having their profile on the ready has been very useful for me and for a lot of users that are using the platform.
Does anybody else have a question?
I can hop in. I'm just so grateful to have parents who are using their energy in this direction, and these are both extraordinary resources. So thank you so much. I've just hopped on to Librarey and made my first account, and I'm really excited about it. I am curious if you're able to look from the back end and see if there are areas across the US that are like more populated, because as you were saying, like, these resources that are particularly useful is like, that this church offers care twice a month, or, it's really this word of mouth, hyper local resourcing that can be super helpful. And I wonder if you have a sense of, are there areas within the US where you've really broken through to that level? Or is it, and is that the vision eventually, or kind of?
That is definitely my vision.
Yeah.
It is spotty. I would say Virginia is probably the most resource because I live here and I started with Virginia. Tried to do a very thorough deep dive on the state. I then was very ambitious and tried to go in alphabetical order for all the states, but would get, and this is similar, not similar to Ryan, but Effie somehow stumbled across me sharing one of the very, very early versions of the PDF, and asked if she could put it on her podcast website. And I said yes. And then I started fielding a lot of DMs on Instagram, being like, what do you know about South Dakota? And I was like, I haven't gotten there yet. So I'm only in Alabama, but hold on, give me a day and I'll get back to you. So I did not quite go in order. I would say the Northeast, Southeast, the West Coast, Texas, all have a lot. Every state has some, but the Mid and Central America definitely needs help, especially from the people who live there. I did the best I could with what I could find. But our vision is that it really gets taken up by the community members and becomes hyper localized.
Yeah, I'm gonna have a local call to action with the couple moms that I know that are just like wild about this stuff. I feel like you always know you're like one friend that you can go to who knows it all. It's like we need those women or men, fathers included, who just will plug it in. But it's really exciting. Thank you.
Cherry pick from like some of the larger rare diseases, or not necessarily rare disease, like the Down syndrome chapters for every state. I would like go look at their resource pages and see what I was kind of like on like a little information rabbit hole. I would click and click and click and click and click, and then somehow I ended up over here learning about this random thing in this random state. And that's how I started. But yeah, that's the vision. And we started adding even resources for other countries. But Albert and Fonson told me I needed to reel it in. We had to really focus on the United States and, perfect it here before, I'm super ambitious. I wanted to do the whole world in a day.
No, I think Laura's idea, Sierra, of finding like individual parents who are just have all this energy and have done all of that work and want to share what they know and help other people cut through the crap and the line, and like that you will, if you find each of those people, it'll just.
Yes, I would love, pipe dream to have, like a state ambassador, or, we could even break it down more localized than that, but at least one person from each state who really kind of understands the niche of the state and like their specific, especially when it comes to the government offerings for that state, is really the expert.
Because there is a lot there's a lot that's state specific.
So much of what we've talked about tonight is so refreshing, and I don't know what heartwarming, because it really is parents driving change for other parents and working in a coordinated fashion. Like even watching how Mejo is working now with the Rett syndrome community to sort of personalize it so that it becomes the tool that they need it to be. And Sierra finding the different parents who can pull in the different resources, especially in different pockets, especially in resource void areas. If you can find those parents, we struggle with that at Courageous Parents Network too, right? To find those parents and speak up. So I want to be cognizant of the time and everybody's time tonight. We've hit the 9 o'clock time frame, and I know you guys both have little kids that you gotta do the things with, and so I want to thank you both for being willing to come tonight.